vision, spirit, creativity. Forces that drive discovery and innovation. Forces at work in American industry. Improving life today. Inspiring progress tomorrow.
Dr. Rex E. Luttrell, MD of Little Rock, Arkansas, helps people find relief and remedy from obesity and excessive weight. Obesity threatens the life and happiness of millions of people and is ranked the second leading cause of preventable death in the U.S. The clinic is headed by Dr. Rex Luttrell, a specialist in lap band procedures and other surgical methods of controlling appetite and weight gain. Dr. Luttrell and his staff are dedicated to the proper treatment of obesity, having conducted hundreds of procedures for the young to the middle-aged.
As people gain weight over time, they commonly develop heart disease, diabetes, cardiovascular disease. All these conditions play havoc with the body over a period of time. The Roux-en-Y gastric bypass is an operation that's been around for the last 25 to 30 years. It's typically been the gold standard operation. However, there's a new operation called the lap band procedure. It was FDA approved in 2001. It's really gaining popularity based on its non-invasiveness, the ability of the patient to get back to work very quickly, and the very low complication rate long term.
The government and medical establishment have only recently recognized obesity as a medical condition and not only the result of bad diet and lack of exercise.
The criteria that I use to see if someone is a suitable candidate for weight loss surgery is what's called the body mass index. And we get that by, it's a mathematical calculation of taking the weight over height, and it gives us a number. There's a range of BMIs from 18 to greater than 40 or 50, but generally 40 correlates to somebody who is about 100 pounds over ideal body weight. Those that are under 40, say in the 35 to 40 range, they may as well be candidates for having weight loss surgery if they have diabetes, high blood pressure, or heart disease. Likewise, these same criteria are what insurance companies use to determine a claim.
The most remarkable thing that I have observed here at Dr. Luttrell's office is the look on the patient's face when they find out that they've been approved for the surgery through insurance. I mean, they're so excited that they cry.
Obesity has reached epidemic proportions worldwide, threatening the health of millions of people. In the pursuit of relief, lap band systems have become one of the most advanced and effective methods of reducing body weight.
Because of my weight, I have had health problems, which has caused diabetes, fibromyalgia, and joint problems for me.
Most people, if they've been obese for many years, they develop comorbid medical problems like diabetes, like hypertension, like degenerative joint disease. And I think for a while a lot of people honestly feel like they can handle their obesity, that they can get on a diet and lose weight. But once these medical problems become more into the forefront of their whole condition, their whole medical condition, they see that they're out of control, and it's at that point where they seek medical treatment.
It's been about 9 months since I had the procedure. I've lost about 60 pounds, significantly lowered my body fat, and now have a lot more energy to run around with my kids, and I have no problem getting up and running across the room for something.
After the lap band surgery, and in conjunction with an improved lifestyle, which is very important, these patients have an improvement in their self-esteem. They feel better about the way people look at them, their families feel better, and they're more on par with everybody else.
The office of Dr. Rex E. Luttrell, MD, where dreams, health, and happiness can be reborn.
The lap band is made of silicone. It basically is a circular piece of plastic, if you will, connected by tubing to a round infuser port. This band is placed laparoscopically after someone is put to sleep. It is placed around the upper portion of the stomach, right near where the esophagus ends and the stomach begins, creating a very small pouch. After the pouch is placed, this little infuser port down here is adjusted by placing a needle through the skin into the port and adding a certain amount of saline. By inflating the balloon of the lap band, that produces satiety. When people eat, they can only eat a certain amount of food. That small amount of food sits in the pouch around where the lap band is placed. It sends a signal back to the brain that says, I'm full. That is the most common way that people lose weight with the lap band.
I felt a lot of hesitancy to have something done because I felt like, well, it was saying that I couldn't do it on my own, that I couldn't lose weight, I had no willpower, I didn't know what to eat, I didn't know how to exercise, and I knew those things weren't true for me, just nothing else had worked. And I felt that the lap band was more of a tool as opposed to a permanent alteration. It was something that would allow me to have that control, to be able to show some willpower, but to help me get through that crucial time that I needed to get the weight off and better be able to maintain it.
The great thing about lap band is that it is reversible. If there's a problem and it needs to be taken out, it's a simple procedure. They cut you a little bit, they take it out, it's over, it's done with.
For successful weight loss after surgery, it's very important that I feel people should be structured in their life, and that would include diet, exercise, and somebody that they can lean on to help them achieve their goal in weight loss. And with the combination of those two and the instructions that we give them for part of their treatment, most of them are very successful.
Continuous education, communication, and expert evaluation keep the office of Dr. Rex Luttrell at the leading edge of weight loss medicine.
The lap band to date is one of the most technological advances for weight loss surgery that we now have. One of the other things that is rapidly becoming more popular is robotic surgery. That is done non-invasively, it's much more precise, it is less trauma for the patient. There are going to be many things that come out in the future, and we intend to stay on the cutting edge of that.